Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy Clinical Case Series. In this episode, I'm going to do things a little differently. I'm going to present a case to you in full, and then leave it to you to think about for a while. Then next week, I'll release another video in which I analyze the case and present to you the results as they occurred. So let's call this episode Clinical Case 10A, and next week I'll release episode 10B. Okay, so let's get started.
This is the case of a 32-year-old high school teacher named Stephen. Stephen originally sought my help for his anxiety, which he'd had for many years, but which became significantly worse 6 years prior when he woke up one morning with vertigo. The first episode of vertigo was the worst, and it hit as soon as he got out of bed. It forced him to lie back down. Ever since then, the vertigo comes and goes, but in a milder form. It feels as if I'm in a boat, swaying to the right, he said. He sought medical treatment, but, not surprisingly, 2 different antidepressant medications failed to provide relief. Presently, in addition to taking Zoloft, he's taking Xanax for the anxiety on an as-needed basis. I asked Stephen about the history of his anxiety. I was a very sick child. It revolves around health, he said. I underlined this 3 times, which I'll designate here with a 3. If I get a gas pain, I think my appendix will burst. I perseverate and blow little things out of proportion. He recently consulted an ear, nose, and throat doctor who ordered an MRI scan. I didn't get the scan. It sent me into a tizzy. I thought I had multiple sclerosis. Upon further questioning, Stephen noted the following about his anxiety. It was worse in social situations, worse from public speaking, and worse from anticipation, underlined 3 times. I'm an introvert, he said. I've been thinking about the start of the school year all summer. This was a reference to the fact that he would soon have to resume teaching. Stephen said that he usually sleeps well, but that his anxiety gets worse if he doesn't get enough sleep. I asked if there were any symptoms associated with his anxiety. He said that it can cause trembling hands, cold feet, frequent urination, and urging to have a bowel movement. When asked about specific fears, Stephen said that he was afraid of medical things, underlined 3 times. He gave an example of a TV commercial about childhood cancer. He said he was afraid of dying, underlined 3 times, and afraid of hospitals. Additional fears that he admitted to upon prompting included fear of flying, underlined 3 times, fear of tunnels and bridges, fear of suffocating, fear of crowds, heights, bees, water, and especially fear of public speaking, underlined 3 times. In trying to understand where all these fears could be coming from, our discussion led to one particular childhood trauma. Stephen told me about how he had been born 8 weeks prematurely and placed in an incubator in the ICU. Subsequent breathing trouble led to the discovery that he had a cyst growing in his airway. Surgical treatment at the age of 2 to remove the cyst included a tracheotomy in order to allow him to breathe. The ostomy was subsequently allowed to heal over. Perhaps related to this was chronic neck pain that Stephen described as radiating from the neck to the frontal region of the head. I then asked Stephen about his generals. He was decidedly warm-blooded, underlined twice, remains covered in bed, and likes to sleep with air conditioning and an overhead fan. I like having air, he said. He is least tolerant of hot, humid weather. He typically sleeps from 10 p.m. until 7 a.m. and said that he's more of a morning person. He sleeps on his left side, and he has a mild dip in his energy from 5 to 7 p.m. When asked about his food preferences, he said he liked the following: granola with fruit, pizza, pasta with chicken, fruit smoothies, plain yogurt, lamb, mashed potatoes, and filet mignon. I asked him to put the following 4 tastes in order of preference: sweet, sour, salty, and spicy. He hesitated and said salty, sweet, and mildly spicy in that order. He had no interest in sour things. Food aversions included collard greens and seafood. His thirst was neither strong nor weak, and he preferred to drink seltzer. When I asked him to describe himself, he noted that he is laid back in some ways and uptight in others. He describes himself as competitive, frugal, and friendly. When asked if he was more open or closed, he chose closed. He admitted to sometimes struggling with an urge to gamble. Okay, that's the case as I originally took it. Now I'm going to give you some time to do a little research and to think it over. And then next week, I'll drop the video with my analysis and the results from treatment. Until then, be sure to subscribe and tell all your friends about the All Things Homeopathy channel. May the vital force be with you.